Research shows that Americans have more fatal heart attacks during the holiday season than any other time of the year. In fact, according to a study published in Circulation, the top 3 days for heart attacks are December 25th, the 26th, and January 1st, respectively.
So why is that? And what can we do to help prevent heart attacks from happening? In today's edition of The Doctor Will See You Now, we've invited a cardiologist with Dignity Health Glendale Memorial Hospital, Dr. Raed Bargout. Thank you for being here. This is your second time here, right?
Yes.
Yes, great to see you again.
Thank you for having me.
Oh, this is a tough one, you know, and it happens at a very important time of the year during the holidays. Let's really break it down. What is a heart attack, and when it happens, what is it doing to the heart?
The heart is a muscle, and for any muscle to work, it needs oxygen and nutrition. And the heart, as a muscle, gets its oxygen from 3 small arteries. Small, like around 2 to 3 millimeters in diameter. Wow. When you have a plaque buildup, cholesterol buildup in one of those arteries, then you can have a cardiac event, which manifests as chest pain, heart attack, or even sudden death, unfortunately, which can happen. Heart disease is the #1 killer in this country.
Is this an operation that you did here?
So basically, as you can tell, there is a sudden blockage in a major artery that's called the left anterior descending artery. We call it the widowmaker. And with the catheter, we're able to open the artery and put stent. And this is how we treat heart attacks.
All right, so what are the warning signs of a heart attack?
The most common signs usually is chest pain, described as central or to the left side, squeezing, pressure type. That is the most common symptoms, but there is other symptoms. Shortness of breath, a sudden sense of fatigue, jaw pain, upper back pain, feeling nauseated, vomiting. Especially women and elderly can have atypical symptoms. That means you do not have necessarily chest pain, but you can have some other symptoms, specifically jaw pain or nausea or vomiting.
And those symptoms are very similar to like an anxiety attack or a stress attack. How do you know the difference, or do you?
Well, again, the only way to know exactly if you're having heart attack or it's just something from your stomach, something you ate, or it's an anxiety attack, is by going to a hospital and having the proper testing done. This is one of the reasons why during the holiday season the fatalities from heart attack goes up, because people want to avoid going to a hospital, spending hours in the emergency room, and they end up having heart attacks at home.
Of course, people are drinking more, they're eating more. What should they try to avoid during the holidays that could lead to a heart attack?
As you mentioned, those are some of the reasons why heart attacks incidence increases during the holiday. Excessive eating, too much salt, drinking too much alcohol, lack of sleep sometimes. Some people even do not have enough medications because pharmacies are closed, physicians' offices are closed. So if you are hypertensive, if you're diabetic, you gotta make sure that you have enough medication to get you through the holiday season.
And stress can be a big thing too.
Big one.
Yeah. All right, and then what exercises can we do to help alleviate it?
So I would recommend that if you're not exercising before the holiday, do not start during the holiday. But if you do exercise routinely, then continue your routine. Cardio exercises are jogging, walking, swimming. I would avoid, lifting weights. And again, moderation in food and in exercise as well.
All right, what about sleep?
Sleep is essential, as we were talking before the segment, at least 7 to 8 hours of quality sleep is important, and it will reduce the amount of stress as well.
All right, well, thank you for the inside scoop on everything. It's so interesting. The symptoms are different a lot of times with men and women, right?
Correct, absolutely.
Yeah. All right, thank you.
Thank you.
Education is key, right?
Thank you. Thank you for having me.
All right, for more information on Dignity Health Glendale Memorial Hospital, you can go to dignityhealth.org.